Thank you, Lucas. This is a session Spine 2. The moderator, Professor Andres Dimitriades, excused himself. He had rescheduled his plane, so he is on the plane now. So I will moderate this session. My name is Đula Đilvesi and I'm from Serbia. So I would like to ask Nenad Filipović from Serbia to give his lecture named Computer Modeling and Artificial Intelligence Application in the Spine Biomechanics. Please, Professor.
Thank you very much. I'm very glad. I hope you can hear me and see me. I hope, and also my slide, right? Just confirm me that you can hear me.
Yes, we can hear you.
Okay, thank you very much. And I will present the lecture, which is actually a combination of artificial intelligence application and also physical-based modeling in biomechanics. And in this presentation, you will see the beyond state-of-the-art actually of computer modeling and artificial intelligence algorithm in the spine mechanics, where we apply some very new algorithms for artificial intelligence and machine learning, and also image segmentation with localization of vertebra and disc in the radiological images and computer-aided diagnostics. And we developed some kind of decision support system with prediction of the disease, this hernia, and also biomechanics and motion analysis. So from the technology, we applied a very complex finite element model, which includes geometric modeling, material property assignment, application boundary conditions, and validation with real clinical application. And we use two different approaches: computational modeling, which is physical-based modeling, continue-based modeling, and finite element method. And we investigate displacement and the stress distribution in spinal disc, the vertebra. And we apply machine learning, specific machine learning algorithms to perform automatic segmentation of regions of interest, vertebra discs, and also we make some kind of decision support system for spinal problem diagnosis. So when we focus on the spine segment, so we focus on the pretty much on the discus and spine segment with the cartilage. And this is actually very important to understand what is the physical inside each cartilage and spine segment and vertebra. And we make some kind of formulation with solid displacement and fluid pressure, and formulation with the solid and fluid displacement for each finite element, the part of the problem. And also we have solid displacement, fluid pressure, and velocity, and formulation with fluid pressure, fluid velocity, and electrical potential, which is actually inside the cartilage and inside the domain of the space for the finite element simulation. So a number of the governing equations are employed, like porous deformable medium. And I know it's this is actually medical community here, but at least just I will show a few equations just to give you just impression how complex model is. So we inside the model have solid equilibrium equation with the equation of the fluid phase and the solid phase. We have total stress, we have mixture density, and effective stress. Also, we have inside the fluid equilibrium, the fluid continuity equation, volumetric strain rate, and compressibility of the solid and the compressibility of the fluid, because inside the cartilage, actually, we have porous deformation model and continuity equation, because, of course, this is fluid motion segment and fluid dynamics. which are incorporated inside the problem. Also, we have swelling pressure, which is characteristic of the each intervertebral discus, ion concentration, and Fick's law, which is actually combination Ohms and Darcy law. So also we in our laboratory have a cartilage tissue engineering where we develop some kind of the new model for tissue construction surgery and the concentric cylinder bioreactor. And also we are doing computer simulation in order to optimize the the concentric cylinder bioreactor and the best design for the material properties. We are using also silk scaffold for the making the new material, biomaterial of the, which could be replacement the intervertebral disc, and also some new approach for the silk characteristics. As you probably know, the silk can stop the Boeing, the biggest plane, if we can make 100 meters diameter the silk network, it can stop the plane the full speed. So it's very interesting material, and we develop a lot of in our lab continuum mechanics and biomaterial mechanics for this methodology. Then we focus more on the comparison of the normal and herniated disc, and we are doing a lot of medical imaging approach in order to see what is the normal disc, what is the herniated disc, and how we can, from the medical imaging, make some kind of the construction and geometrical reconstruction. So if we compare the different grades of the herniation, we have, of course, protrusion, prolapse, intrusion, and sequestration. And also from the MRI, we can see the overview of the image and what kind of image we can collect, what kind of augmentation procedure we can put, and also from the A is original image, horizontal B is horizontally flipped image, C is image with the pro brightness, and D is zoom in the actually of the image. So we employ the specific unit architecture. It's machine learning technology using in medical imaging approach, and this unit has the shape of the letter U. That's the name why it's called U. And it consists of contraction path name encoder, expansion path name decoder, and we have contraction path consists of 3 multiple 3 convolution layers and 2 max pooling of at each level. So that means actually the size of the input image, which gradually reduce while the depth gradually increase, and the more advanced features are extracted, which means that the contraction path is performed the following idea of the convolution, one layer network to drop out and max pooling. So the input, the first step in the contraction part actually is presented here in the where we have, for example, resolution 256 multiple 256, and then we have 3 images in depth. Then we have 16 layers. Also, 16 layers become the comes in the in contraction path, and this process is repeated 3 more times. And the next starting neuron goes to 64, 128, etc. So convolution and max pooling is actually repeating 3 times. And this is also the bottom of the U network is reached with only 2 convolution layers without max pooling. How it looks in the final predicted mask is presented here. It's actually last step of the expansion path before creating the predicted mask. And we have the current image size, which has been changed from 16 multiple 16 multiple 226 to continuation process of expansion path. We call it decoder. And in the decoder, size of the image gradually increases and depth gradually decreases. So in each step, actually we have an expansion path and 2 consecutive convolution layers which are implemented is inside the algorithm. So when we compare the original image on the left side and manual annotation on the center and the automatic segmentation on the right. We can see the optimization values on the axial view image, which are presented here. So in our proposed methodology, we are starting from CT or MRI images, going to the patient-specific geometry, build the model, geometrical model, do boundary conditions, put material properties, if we have, of course, and or assume the material properties from the patients, and look at the results in the finite element solver, which we developed many years in our lab. So the point is actually to see, focus actually on the vertebra from L3 to L5 to see what are the stresses and the displacement and actually distribution inside the model. So when we compare the models from the healthy person on the left side and the person with the disease disc herniation on the right side, we can see at least the difference, of course, in the deformation of intervertebral disc and also different displacement, different stress inside the cartilage biomechanics. When we compare the normal on the left side image and the herniated on the right side from L4, L5 lumbar disc, we can see effective displacement and difference of the displacement in order actually of the formation of the cartilage, and see the difference for disease cartilage. If we put in the total displacement for the normal held from L4, L5 disc and in X and Y direction, we can see the difference. So of course, the more difference is in X direction because we have actually the loading in this direction from the point of the view where we put the total system, but also we can see distribution for the total discus and positions. Displacement of the herniated disc is different. We can see the difference in X and Y direction, but also the numbers are quite different. We can actually see the deformation and see the percentage of the deformable of the disease cartilage. So actually with this approach, we can say that we put the both biomechanical and also machine learning technology. And from point of view of the computer time, it is really high performance computing problem because we have to model very specific internal vertebral disc, very specific bones around it, and also to allocate the loading, so different loading during the clinical environment. So in this actually problem, we investigate the effects of elastic model and the effects of nonlinear material properties, biomechanical behavior of finite element spine, and also taking into account the different range of angular motion, the stress and the strain distribution inside the count. So we can say for each specific patient, we can develop for him exactly the stress strain distribution, the actually biomechanical model and mechanical behavior around this, but also to see the different in the images from the machine learning level. So from micro level, detailed structure modeling approach, of course, needs very specific material properties, mechanical properties of single vertebra or intervertebral disc, or combination of them in all the spine units or large portion of the spine which was applied. So the present approach, we are sure, will open new avenue for computer diagnostic system, which will be helpful in generating diagnostic results in short time and full application, new modeling approach for studying biomechanics of the spine. Regarding machine learning technology, so also we presented some kind of decision support system which can help clinicians in order to make decision for the specific diagnosis of this hernia and developing of disease. I didn't present here the model for developing disease, but also you can imagine then if we make some kind of validation for the current disc hernia diagnosis, I'm sure that this system could be applied, of course, with the with a lot of help of clinicians of the some kind of decision support system for the risk stratification specific patients. This is unique combination of machine learning and finite element methods, which is combined in one parametric model, and it is also adaptable where we're using machine learning methods for segmentation, for medical image analysis and 3D reconstruction, and then using it in finite element model. This computer diagnostic system can be helpful in generating diagnostic results in a short time with reduced time for treatment decision with operation, drugs, and etc. In addition, the accuracy of diagnosis can be increased, of course, and human errors which caused by environmental factors or visual errors of the non-experienced radiologists can be also eliminated. So we think that this of course, pilot study, short pilot study could be further improved. And we are also very much, we want to thank our colleagues, Professor Lucas and other colleagues for very good collaboration for these projects. And I think this is just beginning, and I hope for the next Congress we will present much more results and very, very clinical oriented tool, actually clinical decision support, which can be helpful for the making decision, but also to tool for the help in the treatment, and also tool for the predicting the risk stratification of the patients. Also, I can say that we also have a lot of experience in other decision support system for cardiovascular disease, and also we have built the software for the risk stratification of the cardiomyopathy and cardiac disease and heart failure, which is also relies on the similar tools for machine learning technology and finite element model, and also relies on the different technology for medical imaging segmentation and 3D reconstruction. All of this technology are actually use a lot of computer power, and as I said in the beginning, this is not possible to run on the simple PC or laptop. So we are using high performance computing resources at University of Kragujevac, where we have more than 2,000 CPU processors, and also we are using GPU for developing the machine learning algorithms, unit technology, and deep learning technology, which are actually used here. So that is all for my presentation. Thank you very much.